High-risk pregnancy, pregestational conditions. We're going to go through a few of them here, and then the others will be on other videos. But let's start with a question. Which drug, when ingested by the mother, is associated with low birth weight, preterm birth, spontaneous abortion, placenta previa, abruptio placenta, PROM, which is premature rupture of membranes, cleft lip and palate, and SIDS? Well, your answer is tobacco. Tobacco is associated with all of those. It's also associated with cleft lip and palate, SIDS, middle ear infection, chronic respiratory tract illness, and a lower lung function in the newborn. While the exact mechanism by which the fetus is affected by maternal tobacco use is unknown, it's believed to be an exposure to carbon monoxide and nicotine, and then there's a decreased availability of oxygen. Let's move to alcohol, another legal but very dangerous drug for pregnant women. Damage may be done at 3 to 8 weeks of gestation, before the woman even knows she's pregnant. Now, damage can occur at other times as well throughout the pregnancy. With chronic use, we've got malnutrition of the mother, especially folic acid and thiamine. Now, what's folic acid deficit associated with? Neural tube defects. There's also bone marrow suppression, an increased incidence of infection, liver disease, and withdrawal, or what some people call the DTs. Now, these can lead to seizures. In fact, this withdrawal can lead to seizures, and these seizures can occur in labor, 12 to 48 hours after a woman's last drink. It can occur postpartum, and they can also occur in the newborn as part of newborn withdrawal from alcohol. Here's a very interesting picture of a normal brain on the left and one on the right of a child who had fetal alcohol syndrome. Any organ or system in the fetal body is susceptible to damage from alcohol consumed by the pregnant woman. Now, we're really worried about the brain. Alcohol destroys fetal brain cells and causes a thinning of the brain tissue and structures. It can be a lifelong impact, lifelong damage. It can be massive or it can be slight or anywhere in between. It can be to the point where it's incompatible with life. Fetal alcohol brain damage is the primary cause of mental retardation in the United States, but it affects all fetuses. Fetal alcohol exposure will affect all fetuses. So here we've got it: mental retardation, microcephaly, mid-facial hypoplasia. That means the center of the face does not develop as it normally would. Cardiac anomalies, intrauterine growth retardation, a teratogenic effect, and fetal alcohol syndrome, or what we call fetal alcohol effects, which is a less serious form of this thing. As children, people with this fetal alcohol syndrome or effects tend to be hyperactive, impulsive, have poor attention and memory. They have sensory integration dysfunction. That means all the sensation that goes on in daily life, listening, seeing, feeling the breeze, being in a classroom with other kids, they can't deal with it as well. They have trouble separating fantasy from reality, and they lack the boundaries in regard to people or property. They may get too close to people, they may take things that they want and not have that concept of, no, you can't just take it and use it, you have to ask for it. They have dangerous behaviors and poor abstract thought processes. They make poor judgments. They keep making the same mistakes, and they're prone to high risk and violent behaviors. Just a couple words on heroin, methadone, and marijuana. Heroin and methadone are narcotics. You have to remember that. All the risks of narcotics are here in these drugs, and the mother is experiencing them, as is the fetus, and then the newborn. Because if it's in the mother's body, it's in the newborn's body. So we're talking addiction, withdrawal, and the poor fetal growth. Marijuana, we're not really sure. We haven't been able to point to and find any teratogenic effects, but who knows? We really don't know about that one yet. Anemia. If someone is anemic, they have not enough red blood cells to perform what they need to do in their daily life. They don't have enough to do to support in pregnancy what they need to do for their own body, this mother, for her own body to keep growing and growing adequately, putting on enough weight. They just can't do it because they don't have the red blood cells. And the fetus also does not grow appropriately. These women are fatigued. They don't have the endurance they need. And if this continues and gets kind of bad, they can have cognitive problems and difficulty with problem solving and slow wound healing. Someone with iron deficiency anemia, we need to make sure they know where to find dietary iron and also get them iron supplement. Going along with that, remember, iron causes constipation, so we need to make sure they know about activity and fiber in their diet. Vitamin C helps to get iron absorbed better, so taking iron with orange juice is fabulous. Sickle cell anemia. Well, that's a different kind of anemia, so we still have all the problems of insufficient red blood cells to do a really fabulous job in helping mama to grow and fetus to grow. On top of that, we have vaso-occlusive crises. That means some blood vessels get clogged with these sickled cells. That's going to cause pain, but it also means that that part of the body is not getting well perfused, not getting all the extra oxygen that is needed, or the glucose that is needed. This can lead to problems with the fetus growing. You know, if the placenta happens to be one of the areas where a vaso-occlusive episode is going on, the fetus is not getting a lot of fresh blood. But it also means mom is more prone to infections, congestive heart failure, and renal failure. The fetus, well, we've got fetal death, increased risk of fetal death, prematurity, and intrauterine growth retardation. So what do they need? Folic acid is the source that they really need added to their diet. So we're going to talk to them about sources of folic acid. When they're in the hospital, we want to make sure we're getting them oxygen, a supplemental oxygen. And all throughout, they need adequate hydration. Adequate hydration seems to help defer or deflect some of the crisis period. These people are having pain, so they need analgesics. It's real pain. They may need narcotics. We need to help them identify the triggers, and we need to make sure they get prompt treatment for infections and vaso-occlusive crises. I'm not going to do a whole lot about heart disease. In pregnancy, congenital heart disease and mitral valve prolapse seem to be the two that are the most common types of heart disease. But think about it. Mama has an increased blood volume. We're asking the heart to do a lot more work, pump a whole lot more blood, and take care of a whole lot more weight as she puts on weight with this pregnancy. So it's an increased workload. She is more likely to run into heart failure at this point in her life. And what may have been heart disease that was class 1 may move up into class 2 or class 3 during pregnancy because of this increased workload. So class 1 basically, quite often it's a mitral valve prolapse. She's got no limitation on physical activity. Yeah, her heart valve doesn't close real well, but it doesn't cause any problems. Class 2, a slight limitation. If she decides to increase her activity, then she becomes symptomatic. Normally, what you would do in an increased activity period, she would experience shortness of breath and fatigue. But she's okay when she rests. Class 3, she's got lots of limitations on her activity. She is symptomatic with normal activity. She can function, but it's really hard for her to go upstairs. But she's okay when she's resting. She doesn't have any symptoms when she's resting. Class 4, she's got symptoms all the time. She can't do any physical activity. She's got symptoms when she's at rest. She's got symptoms with any kind of activity. This is very serious heart disease. Infections, I'm going to send you back to your text. I want you to really look at Group B streptococcus, rubella, and herpes simplex. I want you to know about it. How does it affect the infant, the fetus? How does it affect the mother? How is it transmitted? And how is it treated? A few words on urinary tract infections and pyelonephritis. Remember progesterone. Progesterone relaxes things. Well, that includes the ureters and renal calyces. They dilate, and they don't keep things moving forward as well as they used to. So it's more likely for urine to wash backwards. And we're more likely to get an ascending infection. Complicated with pregnancy is the weight of the uterus on all these renal structures. There may be some obstruction, and it's harder for the kidneys to completely empty, which again increases the risk of pyelonephritis. As with the heart, think about, we're asking these kidneys to filter and reabsorb and all that, to process all this extra blood that a woman has when she's pregnant. All of that puts a woman at risk for acute renal failure, especially if she has any underlying renal disease.